Hello and welcome to another recorded training session for RPMS EHR. My name is Katie Johnson and I am the EHR Integrated Care Coordinator at the Northwest Portland Area Indian Health Board. Hello, today we are going to talk a little bit about the family history and the surgical history and how to document those in EHR. Time for my disclaimer. In all of these recordings, the database that I am using is a scrambled training database. It contains no real patient information. The data may look real, but it is not. As you can see in this system, we have a series of tabs that are on the problem management tab. So we have tabs within a tab. We covered the IPL in a different presentation, and there are plenty of other tabs that might be in here. I'm not going to go into detail on these other ones today, but I did want to mention the family history tab and the surgical history. Family history is fairly self-explanatory, but it is the place that we capture family history of the patient and things that might influence a decision or show that a patient was at a higher risk for something, or just to document a better picture of the patient. So to add something in here or to edit something that's already there, if you want to edit something that's already there, then you highlight it, click on edit, and now you have access to put anything in here that you might need to do. So maybe the status of the relation has now changed because they died, or you found out some more information about the problems that this relative had. To add something that the relative had, you just simply click on the add button here, and you get the very similar type of lookup that you might have seen on the IPL, because all of this data is becoming, as we're capturing it, is structured and it's getting coded, and it's just building a history for this patient and things that maybe can be pulled out later. So here we have, it's searching for family history, and it's just plenty of different things that you can search for, and that may be something that you want to add for your patient. And you again have provider text that you can add anything extra that helps explain the problem. Agent diagnosis, it can be approximate, anything like that. I'm just going to save it there, and I'm going to save. So now it added a second instance of sister. Even though we edited and we're talking about possibly the same patient, it does throw it in there twice. So here we had this family history of diabetes, and here's the allergic rhinitis that I just added today. To add a whole new relation, you click on add relation, and again you have a blank box to fill in, and you can see all the different options that you have here of different types of relations. It's pretty extensive, but it's not a free text box. But there is even an unknown. So there you have just a little overview of a place to document family history of a patient, and also a place to look for information that might, as you're getting to know a patient, if you've got extensive documentation in here, this is a place to look to get a better picture of the patient. Now, surgical history I'm going to cover here because this is maybe not immediately obvious, but this gets used quite a lot when we are talking about adding historical services, particularly to meet GPRA. So that's a common thing where we say, okay, maybe our site doesn't do colonoscopies or mammograms, but an outside site does, and I I got a report back, or your clinic has a process to cover these things, or the patient brings in something that says, hey, I've had this done. Surgical history is where this gets documented. There's a GIP services pick list that you have access to. I got there by clicking on the add button, and then I can check these common things here. I can give an approximate date of when this was done, where it was done, if I have that information, if it was done at another IHS or tribal facility or other. You have a free text box here. There's also a separate tab there to look up other types of procedures and fill in as much as you can about anything of the procedure that you know about. But again, the GIPRA pick list for historical services is probably the most common thing that gets used on here. Just wanted you to point out that this is how and where you can document to capture that data in a structured way so that it counts for GIPRA, or it can be searched upon later, or anything like that. If you just mention it, text and a note, that information likely could get lost. Here, you get it documented so it can be seen by reminders and other providers and things like that. I should also point out there are different categories here of the types of historical services. You can see all and get a more comprehensive list. If you only want to see things that are surgical, that's how that works. You can just change it up there. So that is it for today. Nice and short. Just a couple of things I wanted to point out.